Over the last few months, we've heard so much about the COVID vaccine and how it can save lives. But do you realize that there are a number of other vaccines that help in the prevention of health issues? On this week's Health Talk, pharmacist Bob Bepko will discuss other common vaccinations such as influenza, shingles, hepatitis, and tetanus. He'll tell us what these vaccinations protect you against and how you should take them. So stay tuned for a very informative show. Health Talk is up next. Hello, I am Dr. Eric Mazer. Our topic today is vaccinations, and we're pleased to have Bob Bepko, a pharmacist with Nuvance Health, to join us to discuss this very important topic. Bob, welcome back to Health Talk. It's always such a pleasure to have you.
Thank you.
Vaccinations. I think COVID has put vaccine in the spotlight, and we'll talk about that maybe a little later, maybe another time. But let's talk about adult vaccinations. So many people think of vaccines as things that you give your kids and then you're done. Not true.
Right.
So tell us about that.
It's, people talk about vaccines and they think it's bringing the kids to the pediatrician for their childhood vaccinations. Measles, mumps, rubella, those types of things. But there's vaccines that are out there that are specifically, for adults. And it's critical as we get older to receive these vaccines to help protect ourselves, to help us fight off things that have the ability to affect adult patients. I won't say older patients, I'll say adult patients.
I'll take older patients. But I think we all know that as you become older, your immunity does fade. It doesn't mean it goes away,
right.
Healthy immunity, but it's not as robust as it is when you were a kid. And so you sometimes need boosters of those vaccines that you had when you were a kid. But there are also certain disorders like pneumonia,
right,
that tend to be quite more dangerous in older people. So maybe you could let's start with the adult side of things. And what middle-aged adults, what kind of vaccine should they be thinking of?
Well, I like to get the flu out of the way right off the bat because it is important. Each year, when the leaves start to change, it's time for us to think about our flu shots. We had a great low incidence of flu this year because of COVID. A lot of people received their flu injections, but also with us wearing masks, society wearing masks, we cut down on the incidence of flu.
And we probably saved tens of thousands of lives.
Exactly.
And people don't, because the flu is so common, a lot of people think of it as a bad cold. And it isn't, particularly for the elderly. It
right.
is a common source of mortality.
And so, it's like you say, your flu shot every year in the fall when the leaves start falling.
Bob, before we leave the flu, because I think COVID and others have created a lot of confusion about vaccines and their need for boosters. Why do we need explain, if you will, why we need a different flu vaccine every year and why it's so important to each year to get a different shot?
It's important with that flu shot. It changes every year. The viruses are a lot smarter than the human beings who they're infecting. And they mutate every year. And they grow into something else.
And flu particularly, it doesn't just change a small nuanced change in its coat. It literally changes clothes every year.
It's a different virus each year. It's a different version.
And that's why, and I know the flu shot, they try to guess what version of flu is going to be around so that they could prepare the vaccine to it.
The correct dose, the correct variant. What are you going to attack?
Well, I know some scientists are working on a flu vaccine that will work against all the flu variants. It's not available yet, so we're still in this annual.
Right.
Some viruses don't change a lot. Measles, mumps, chickenpox. So one infection, one exposure is
you're
good.
One and done. So that's good with that. But Well, let's talk about a serious condition, pneumonia, especially in older or elderly patients. And
Anyway, Sir William Osler called pneumonia the old man's friend, meaning it was the way that a lot of elderly men exited this world.
exactly.
So this was we don't think of pneumonia as a fatal, but it's frequently the complicating disease that leads to people's death in the elderly population.
And fortunately, with the advent of antibiotics, we've been very successful treating the flu. But
Treating pneumonia.
treating pneumonia. But now we can give our bodies a better chance to minimize either coming down with pneumonia altogether or having a weaker version of things. And there's 2 different pneumonia shots on the market. One has 13 different variants of pneumonia, and the other one has 23 different variants of pneumonia. And what happens now, your healthcare provider will, 1 year you'll get the shot with the 13 variants, and then the next year you'll get those shot for the 23 variants.
And what age is that supposed to start at?
I tell people once you hit 50, you really should, unless you have conditions, whether you're a cancer patient, right, where your immune system is compromised.
Yeah, and I will just say, for the sake of transparency, I've had both those pneumonia shots in the last few years, just for this reason. I've had no special problem, but as you reach your 60s, these shots are indicated to protect you as you move into your senior years.
That's correct.
Now, there's another one too that's, I think, pretty important at a later point in life.
Yes, and it will help you fight off shingles. And shingles is a very, very painful disease. You can get it anywhere on your body. It just is not on your trunk or your sides. Some people develop infections in their eyes, which lead to other complications. But there's vaccines on the marketplace now for adults. It's 2 doses, and it's approximately 90% effective.
Shingles is a really interesting disease. For folks that don't know at home, I know Bob knows this, it's produced by the chickenpox virus.
Chickenpox from when you were a kid.
So you get chickenpox when you're a kid. That virus stays in your body inactively, back in the ganglia, in parts of the nerves in the back, and your body's immune system keeps it under control. So that shingles virus is in our body, the varicella zoster virus, the chickenpox virus. And then as you get older, or you get a virus that weakens your immunity transiently, that chickenpox breaks out that virus, and it causes that terribly painful eruption on the nerve where it broke out from, and that's what we call shingles. It's terribly painful. Some people, once they have shingles, never get rid of the pain.
Yeah, it can be very debilitating.
And here we do have a shot now that prevents it, and this is a 2nd generation shot.
Yes,
I think,
this is actually, yes, this is the 2nd generation of the shingles vaccine, and I recently received my 2nd dose. I will tell you, it doesn't hurt. There's no side effects except for you may have a little swelling in the arm with it, but it's pretty innocuous, and you don't want to come down
with shingles.
With shingles.
And so these are, I think, great examples of vaccines that we have for the older adult. I'd like to sort of flip all the way back to pediatric, because when I was growing up, I don't know whether you remember it, Bob, I do remember the polio epidemics.
Yes.
I remember kids in my kindergarten class, one child getting polio, and the panic that went through the school. We all got gamma globulin shots to prevent it. That was just a transient prevention. I remember my parents saying, don't go in movie theaters.
I remember that.
And I think what's happened, and what I'm concerned about, well, let me take another step back. I have seen, when I used to tutor kids. I remember a family, I was tutoring a brother, and their younger brother had mumps meningitis as an infant, permanently brain damaged from that mumps meningitis. I guess what concerns me a little bit now, more than a little bit, is today's generation of parents have not seen the scourges of these diseases. They haven't seen polio wreck their community. They haven't seen kids who've been permanently brain damaged by mumps or may even die of mumps or measles. And so there's this there is this anti-vaccine theme that goes through some of the younger generation. I just, maybe you could say a few words about the efficacy and the side effects of these vaccines, the relationship, the lack of relationship to autism. I'm just afraid we're damaging a younger population, putting them at risk for no reason.
Why would you want a child exposed to polio and actually destroy their lives? And it's also going to probably destroy the family's lives too. You look back to, way back when with President Roosevelt, who was a polio victim. And
it was pretty common in our youth to see people who were on crutches or wheelchairs who had polio.
But there's no reason for it. We still have an off-site storage facility here that actually has a couple of iron lungs for people that had polio, that had needed help in assisting in breathing. And there's no reason to expose anybody to this.
We've got less than 2 minutes left, but the issue of vaccines, mercury, and autism always come up among some people. Do you want to say some words about that? You're a scientist. You know the science on this.
If you look at all the peer-reviewed literature, somebody would, I can't find anything. The experts.
And there have been very specific studies to look at the correlation between vaccines and autism, and they've come up with really a blank.
There's nothing there to support that.
Now, my understanding is they've taken mercury out of the pediatric vaccines. That was really just to reassure people, not because it was causing a problem.
No,
isn't that true?
Exactly. So that they have a different agent in there to help keep it stable, preserve it free. Preserve the vaccine.
And again, we're down to a minute or so. I just wonder if you'd say something about the HPV vaccine, because this is the first vaccine out there that prevents cancer.
Actually prevents cancer. And I'm thinking that in the future there'll be more vaccines that we'll be giving that could prevent generations of people from coming down and fighting cancer.
So this HPV is the human papilloma vaccine.
Right, yes.
It is generally a sexually transmitted virus. There were several variants. The vaccine covers the most common ones associated with cancer, and it will prevent the development of cervical cancer, penile cancer, and some cancers of the head and neck.
Yes.
So it's really, these are wonderful things. I walk the walk. I'm sure you do too with my family. I've got grandchildren. They're all vaccinated. This is a wonder of modern healthcare.
And you need to take advantage of it, because if you can prevent it, why go on and have to fight it later?
Absolutely. Bob, that's all we have time for. I want to thank my guest, Bob Bepko, for coming on Health Talk today. And I want to thank you for watching. Please feel free to email us with your questions and comments at healthtalk@newvancehealth.org.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.
The COVID vaccine saves lives, yet some people are not availing themselves of this important treatment. On this week's Health Talk, we're going to discuss the benefits of this remarkable vaccine, so please stay tuned. Health Talk is up next. Hello, I'm Dr. Eric Mazur. Our topic today is the COVID vaccine or vaccines and how it saves lives. We're pleased to have Bob Bepko, a pharmacist with Nuvance Health, join us on the Health Talk today. Bob will discuss the importance of this vaccine. Bob, welcome to Health Talk. It's so good to have you.
Thank you.
Well, our lives, the media, everything has been dominated by COVID for this past year. And for these last several months, we've had 3 COVID vaccines that are out there. This is really a remarkable medical achievement. Maybe you could say a little bit about how did we get here so quickly? Why is this so good? And actually, I think we're beginning to see the end of the pandemic as a result.
We've been very fortunate that scientists, physicians have been able to work rather quickly to come up with a vaccine to fight this terrible pandemic that we've been through and we're still going through in lots of different countries all over the world.
And I should point out, as the head of pharmacy here at Nuvance Health and here at Norwalk Hospital, you really lived through some of the worst of it. Some of the worst in the country was here right at the beginning when we knew the least. You could even say a few words about what it was like here at Norwalk Hospital, what your life was like during the peak of the epidemic, the pandemic.
One of the things, it was a scary time. I will tell you, I couldn't have been prouder of being part of the team that was taking care of patients. And when I say the team, I meant every single employee in the building. Everybody came together. We didn't have a lot of knowledge when the pandemic first hit. Inundated with patients, elderly, middle-aged, young patients, everybody coming in for...
Putting your own life at risk. I mean, really,
Right.
I mean, not to be overly dramatic, but we knew so little then. We didn't know whether the
Exactly.
PPE was going to protect you. We didn't even know terribly well how well it spread, how efficient it was, how it did.
And it was the ability of the team in the organization that came together. We met several times a day, from the early morning to late at night, to give everybody updates where we were, how many patients we were treating, what drugs did we need, was there anything in critical supply. We moved a lot of drugs from, we're made up of 7 hospitals now, Nuvance Health. We were able to move drugs where we needed them.
And right at the beginning, we really, other than some basic support drugs, we really had no idea how to treat these patients. I know they were using different things but people were flying by the seat of their pants.
The medical establishment was trying to take care of this disease state. We didn't have a lot of answers. We tried lots of different drugs. Some worked a little bit, some didn't work at all. And a lot of supportive care for patients. Unfortunately, a lot of patients didn't make it because of the severity of this disease. And I think that's part of the reason why, as we talk a little bit more about the vaccine, how critical it is, you need to get vaccinated.
Yeah, let's not forget where we came from and how bad this pandemic was.
Right.
And how dangerous this, and I know that although the elderly suffered and died disproportionately, there were young people that died through this whole thing too.
Lots of young people, middle-aged people, people 30s, 40s, 50s, a lot of people succumbed to this disease.
So let's the vaccines, the COVID vaccines. It goes without saying they were produced in record time. I think no one expected 9 months after the outbreak of this to have a vaccine in trial in human beings.
Right.
Maybe I'll just take a step back. In the past, I think most vaccines were made by growing the virus
in eggs
or something, figuring out a way to inactivate it or make it less active, purifying it, giving it back to patients and hoping that it didn't revert,
right,
or figuring out what part of the virus. This was a whole different approach that was used this time, and very successful. Can you say something about that?
Very successful with manipulating RNA.
Which is a genetic code.
Exactly, it's a genetic code. And by manipulating that, having lots of tests going on with patients, seeing the value that it had, it was able to have been brought to market in record time.
Not to get too technical for folks, but the coronavirus is surrounded by these spikes. It's almost like a mace, a medieval mace.
Yes, exactly.
And those spikes are essential to that virus getting into the cell. So what scientists did is they had the code for those spikes from the code for the virus. And they actually took that code, put it in a longer strand of RNA. That RNA is injected into our body, so our body makes the spike protein, but it doesn't make the virus.
Right.
So there's no way you can get COVID from the vaccine because the vaccine doesn't code for COVID.
That's correct.
Codes just for the spike protein. That spike protein is a foreign protein. The body recognizes it foreign. It makes antibodies and develops T cells against it, and lo and behold, you're immunized. I think one of the things that's so remarkable about this is that model can be used for almost any virus that comes along in the future, too.
Right, and that's why I will tell you, Eric, that the last 2 years were probably, it was the most difficult times in my career. There was a lot of dark days. We had turned it into successful days, but it was emotionally draining, absolutely emotionally draining. I feel very comfortable now because we have this knowledge that it may take us a couple of months to crank something out from the laboratories, but I really feel that we can address anything that's thrown at us in terms of a disease state. The only thing that we need to convince people to do is to help us, help themselves by getting the vaccine. And everybody has to put all the stories aside, whether there's microchips. I mean, that was hysterical when I heard that one. I think we can
guarantee there aren't microchips.
Yeah, there's no
in the
microchips.
vaccine.
But, folks, it works. I mean, it works.
It works remarkably well. I think better than
Exactly.
anybody ever could have guessed that it works.
Exactly.
Why people are worried about side effects, and I think as we have gone on, we've heard about inflammation of the heart, perhaps, in some of the young men, young women for the Pfizer vaccine, and blood clots in the brain. So there are some serious side effects we've heard about. How do we put that in context and still go forward and get the vaccine?
And a lot of, when we got the reports that specific side effects were showing up, if you looked at that in a general population, it was no greater than what would naturally occurred in a general population with people. So your chances of getting sick are very minimal, very minimal.
And I think one of the things we don't deal with well as a people is relative risk.
Yes.
Certain relative risks we accept all the time. When I get into a car, I drive home from here, there is a finite, real chance that I am not going to survive that trip.
Right.
Well, I don't know what it is, 1 in a million.
Whatever it is, getting hit by lightning.
Getting hit by lightning is a real risk, getting eaten by a shark. And there is risk to these vaccines. On the other hand, the risk of dying of COVID, maybe if you're elderly, maybe 1 in 1,000, maybe 1 in 100. If you're younger, maybe 1 in 10,000. Seems to me the risk of getting COVID and dying of COVID still exceeds the risk of these dying of one of these rare side effects.
And I think that if you talk to relatives, you talk to neighbors, colleagues that you work with, they know somebody that has succumbed to COVID. And it's real, it's there, nobody's making this up. Like I say, there were lots of dark days when we were fighting this disease at first, but I'm totally confident that we'll be able to handle anything going forward.
Now, one of our colleagues here in Connecticut, David Katz, who does a lot of online commentary, made a very interesting point about the vaccine and the virus. He said the virus is out there, and Mother Nature did not make it to keep you safe.
Right. That's right.
It was engineered almost randomly, and its negative effects on human beings are what they are. They were engineered into that. The vaccine was engineered by humans to be as safe as possible.
Right.
So why not choose the pathway that is at least everyone was on your side when they designed it, as opposed to taking your chances with something like COVID. And we also know there are long-term effects of COVID that we don't even know fully yet.
And people that came down with the disease, whether they were in the intensive care unit on ventilators, whether they had a mild case, they still feel those effects of the disease that they didn't have before they came down with the disease. Whether it's cardiac issues, whether it's cognitive, their facilities or their thinking processes, their balance, all these things are all...
Or even the PSD, the post-traumatic stress of being in an intensive care unit, which is, we know is stressful as it could be.
Very stressful.
We're running out of time, but long-term effects of the vaccine, I think that's what other people will throw. Well, we know that short-term effects are usually mild, usually not life-threatening. We don't know what the long-term effects are. Do you want to say anything about that?
I would rather take my chances with an engineered vaccine than coming down and having to be treated for the disease. Because I'd rather take my chances that way.
Yeah, and we were discussing before the show, when we look at other vaccines, and again, the other vaccines are a different kind of model, but the issue of side effects from the vaccines at least the other vaccines, they haven't shown up on the long term. Virtually all the side effects of vaccines are pretty short term, within a week or two. And that's what we're seeing with this vaccine.
Whether you have a fever or aches, it's very, very self-limiting.
And I think it's very unlikely that 2 years from now there's going to be an effect of the COVID vaccine that we didn't anticipate.
Right.
Bob, we could talk about this forever. Unfortunately, that is about all the time we have today. I want to thank my guest, Bob Bepko, for coming on Health Talk, and thank you for watching. Please feel free to email us with your questions and comments at healthtalk@newvancehealth.org. Thanks very much.
Our fight against coronavirus isn't over. We still have to slow the spread and do our part. Let's wear face masks in public. Stay 6 feet or more from others. Follow state and local guidelines. Wash our hands frequently and stay home when we feel safe. For ourselves, for our loved ones, for our future. Let's move forward together. Learn more at coronavirus.gov.